we are here to discuss something about the diabetes. We all know diabetes is a disease which is going to prevail throughout the world, and it is one of the very important problems for our country also. Now, there are two parts of the diabetes you can say. So, first, the frank case of diabetes, and second is the pre-diabetic condition. As the name suggests, pre-diabetes means the person is not suffering from the diabetes, but if he or she doesn't take precautions, he may land up with the diabetes in future time. So we must be very clear about what is pre-diabetes. If you go by the report, if the blood sugar fasting is between 110 to 125, or if the patient took 75 grams of the glucose and the blood sugar is between 140 to 199. And if you go by the HbA1c criteria, if the HbA1c between 5.7 to 6.4, these patients is supposed to be a case of pre-diabetes. Now coming to the point, what is importance of knowing the patient of pre-diabetes? We must know if the patient is suffering from pre-diabetes, he or she in future may land up with the frank diabetes. And at the same time, when the patient is suffering from pre-diabetes, the patient has got diabetic complication, even all type of complication may be started at that time. So we must take proper precautions so that we are able to stop the diabetic progression at this level. So if the patient has pre-diabetes, we have to go for the lifestyle modification and go for the different types of diets also. Though there is no medicine required during the pre-diabetes, but we must take proper precaution to get the pre-diabetes. Now question is right, why the patient is suffering from the pre-diabetes? Because the patient has got insulin, which is not sufficient enough to control the blood sugar. So and it is not too low also, that the patient may labeled as the diabetes. So that is the part in between the normal and between the diabetes. So at this juncture, we have to very, very careful to avoid the future complication of diabetes and diabetic complication.